All right, it's been more than 100 days now, and of course, Kenyans have changed, bearing in mind how they have to go about their businesses on a daily basis. And there's one man who has been at the helm for more than those 100 days. It's been 100 days plus 2 weeks. Cabinet Secretary Mutahi Kagwe, thank you so much for your time to speak to us this moment.
Thank you very much.
Right, and let's begin with your reflection on what those 100 days have been. Of course, you've been speaking about it, but is this something that you really expected when you came into the office?
First of all, I didn't expect to be here because obviously, you know, when it comes to cabinet positions and so on, it is not something you actually plan for because it is done at the behest of the president. So the first thing actually I would like to do is to thank the president for giving me this opportunity to serve Kenyans in this position. But clearly, obviously coming in here, I knew about the Ministry of Health. Everybody does. I did not expect COVID because if you remember, December is when the discussions about COVID were starting. And therefore, when I was appointed Cabinet Secretary for Health, the first thing I had to do is to do a lot of reading about COVID. What is COVID? What is it all about? I hear a strange place called Wuhan is now impacting on Nairobi. Right. You know, that whole, is a mind-boggling thing. And on reading more about it, I knew for sure, this disease is going to come to Kenya. And therefore, in terms of my expectations, this is not what I expected. This is what I found. But, as it is in management, in any sphere of management, right, you got to be ready for the most unexpected. And yes, when we came here, of course, when the disease started, it's a question of assessing what we have. What is the capacity? You have to address this disease. And of course, it dawned on me that we actually don't have any. Right? There isn't any. I mean, it's not going to happen. So clearly, the first thing to do is to rush as much as possible to move from these 8 beds that existed at Kenyatta National Hospital, right, to expand our capacity to manageable levels, to at least a point where we can reach and say, we have done a good job, and I think that we can cope with the disease.
Yes, now we saw you launching the 112-bed capacity at the Mbagathi Isolation Center. And one would think that at that time that was too much capacity for the country. Yes. What numbers were you working with at that time? Well,
you see, at the time, to be perfectly honest with you, I don't think anybody knew what numbers we were working with. I think if you are working at 8 beds, getting to 30 and 40 and 100 is a great achievement. So we were not looking at, we need another 10,000 beds. When you are working on 8 beds, you don't think about 10,000. You think, can we get to 100? Can we get to 200? Can we get to 300? And every day you realize that, and as this is happening, you're also getting information globally about the disease patterns and what is happening. You are getting modeling people to begin now working at showing us what can we expect in Kenya. And therefore, what capacity should we be building? And that is exactly what happened. Right. So we came from Mbagathi with our 120-bed facility. Then we realized this is not going to be enough. We went to Kenyatta National Hospital, Kenyatta University Hospital, and we said, wow, now we can do 500 beds. Now we are moving on. We have got 120 beds. We have got 620 beds. That's a far, far, far move from 8. So at that point, you think, now we have got it done. Until you realize you are nowhere near what you are supposed to have. And of course, now we are talking about, every county having a certain minimum, And when you think about what happened in Mombasa and the capacity Mombasa builds in a very short time, then you realize that when Mombasa was working, Nairobi was working to build this capacity. And fortunately for us, I think the whole concept of county governments and the devolved units in the country has really helped us in terms of managing, in terms of capacity building, so that today we can say we have got many times the number of beds that we started with.
The counties would appear like the weaker link in this war, because if counties like Siaya a few weeks ago had just 10 beds, and now you're telling them you need to improve your capacity to about 300, what was happening with the vision that the ministry and the country had so that you're not able to properly estimate what we need?
I think I don't think anybody was actually knew what they needed. on grounds that nobody really knew about the disease. This is something that has been a learning process as we go along. As we go along, you learn new things. For instance, as late as last week, 2 weeks ago, we thought we were going to keep people in isolation facilities, hospitalized in places. Now we have learned a little bit about the disease. You know, the World Health Organization is coming out with new protocols on how to manage this situation. We thought that everybody at one time will have to be quarantined in a facility. I think it is getting to the point where in the next, as we go along and people learn the seriousness of the disease, people take it seriously enough to be quarantined in their own homes. So, and then that affects the capacity that you need to construct. And don't forget, you have got the quarantine facility, you have got isolation facilities, and then you have got treatment facilities. So I don't think that at any time, you know, we were behind knowing what we need. Otherwise, by now, we would have been overrun.
Right.
And we haven't been. And I disagree that, that counties are the weaker link. Actually, counties are our strength. Now, of course, it also depends on leadership in every county. You know, some counties have done extremely well, you know, and look at Mombasa, for example, as I say. Without the county government of Mombasa and the work that they continue to do, it would have been very difficult for us sitting here at, you know, the ministry headquarters to manage the way the county government managed. So it is not a weaker link.
Okay.
It is actually a strength.
And let's talk about, at the start of this pandemic, we thought it's an imported disease. Maybe it was. It was a foreign disease, so it was coming into the country. And so the measures that were put in the first place was to limit the flights and also put protocols on how people who arrive, how they are treated. Now we are talking about more than 4,700 of total infections, and the local transmission is pretty high. How do you think it has moved, it has evolved to what we have now?
Very much in line with every other country. It is exactly the same pattern as elsewhere. The only difference, perhaps for us, is that it has moved slower than it has moved elsewhere. If you take, if you went to analyze and say 100 days from when America got its first case, and you graph it up to 100 days later, what was the fatality rate? How many people were infected? How many people had died? What is the percentage of deaths? And then you draw the same across many countries. That is the only way you know how effective have your measures been. Because you can only compare oranges with oranges. So the disease pattern is exactly what we expected it to be. Right. You know, in fact, I'm talking about pattern, not numbers. Numbers we had projected higher than we have. But the pattern is the same. You get a person who comes from the outside, and we know what happened in Mombasa, in Siaya, the Siaya you have just mentioned. There was a priest who came from Rome, went to a funeral there, and the rest is history. And, you know, disease patterns. Once it starts becoming community spread, then that is a different story now altogether from an imported case. Because an imported case has got very few isolation, very few people you need to quarantine. But a community spread now means that is either A, you are able to contact trace a lot of people, or B, you have to start thinking about home care.
Right. And so when you talk about the measures that were taken in the first place, for instance, there was the self-quarantine at the start, then it became mandatory quarantine, and at some point it felt like it was forced quarantine. I heard you yesterday apologizing for all these.
Well, what I apologize for, and let's get it straight, in fact, Kenyans should be apologizing because of their complete indiscipline. If we had been a disciplined society, the mandatory quarantine that we went into would never have happened, because essentially people would have quarantined themselves. But we know we are who we are. And once we realized that clearly what we expect people to do, what we expect people to quarantine themselves is not going to happen, then at that point we had no choice but to start mandatory quarantine. Now, the reason my apology was in regards to our readiness for mandatory quarantine, because clearly we were not ready for it, you know, but we had no choice but to make do with what we had. And that's why there was complaints about people going into college situations that were not completely ready. So there was a lot of inconveniences caused on people. at the time. And sometimes these inconveniences continue even to this day. So it is the inconveniences they went through that I felt bad about, and that's what I said I was apologetic about, both as a person, as a ministry. But the flip side of it is that that would not have been necessary had we really been a very disciplined society.
It's been a critical ministry, and now what it is now, do you think it was prepared in as far as the capacity of the right doctors, the professionals that need to understand the virology and the epidemiology of the disease? Do you think we have that capacity? Do you feel confident now?
Absolutely. I am very, very proud of the team of experts that I have in this ministry and in the branches that are connected to this ministry. If you look at our research capacity, for example, in places like Cambridge, there are over 200 scientists and doctors and so on who are working there. We have got infectious disease units. We have got people from the universities who are helping us with the modeling and so on. In terms of human capacity, you know, Kenya is pretty well endowed. And I'm happy to say that these are the people we have relied on for a lot of what has happened in the country. And they have done it well. They have done it very effectively. You will see that because of our technology and because of the expertise we have developed, and these scientists and doctors have also got a big network globally, because a lot of them are educated overseas and what have you. So what we are cooperating with persons overseas. Because of technology, you are able to talk to people even in Wuhan who are telling us the case management went like this and the other. So we are able to borrow from elsewhere as well. So we have got both internal capacity as well as our external links because of the technology that exists now.
Right, we'll get back to the ministry shortly, but let's talk about the next 100 days, because like you said yesterday, the disease will be with us for so long. But what do you think we have to do and we must do to flatten the curve that now appears not to be a reality that is in the short term to come?
I think, as we have repeatedly said, is first and foremost, we have not yet hit our peak in the country. You have seen us going up. You have seen figures going now beyond the 200 figure that we didn't think, and we had predicted this, if you remember. We said towards the end of June, July, we are going to be experiencing around the 200 mark figures, which is already happening to us. So going forward, as we head towards July and August, I expect that there are going to be higher figures, particularly towards the end of July. The reason being that people are going to travel more and more around the country, and the more they travel, the more the transmission rate goes higher.
But there is cessation of movement and curfews in the night.
And now, you see, that until the 6th of July, we still remain the way we are, because that is what the order that has been given. Post the 6th of July, we will then determine, you know, what we are going to do. You know, but the question is, when you do that, what then happens? Masses of people travel up country. And when they do, obviously, you can expect the spike to go up. Now, the difference between us and Italy, elsewhere, where when they opened, figures went dramatically high. I think the difference between us is that we are opening at a time when people already know, all right? People already know that if you go home and you go and visit your mother and you don't have your mask, or you visit your grandmother and you're not keeping your distance from them, and you don't have a mask, you are actually heading out there to kill them. And people know that. You see, at least when we began, people didn't believe it, and people didn't know that. People are reluctant to wear masks. People are reluctant to do all the things that we were suggesting that they do. But now I think everybody in Kenya knows.
Can we therefore assume that come the 6th of July, we are going to have reopening, the cessation of movement to be taken away?
I can tell you I have absolutely no idea, you know, because I have no idea. Because it depends on so many things. It depends on what will be happening in the country as far as the figures are concerned. It depends on what will be happening globally, you know, what will the patterns be? Will people already be opening and beginning flights and so on and so forth? Because don't forget, today they announced the highest figure ever recorded for COVID. It is just that people are getting used to this. But otherwise, today was the highest figure ever recorded for positive cases. So it is not as if the disease patterns, the disease numbers are going down. The disease numbers are going up. I think it is just that we have gotten used to these numbers. And people think, oh, okay, it's just COVID. You know, let's move on. It isn't. So it's very, very difficult for me to predict right now what we will be recommending that the president do, because obviously by the end of the day, it is the president's decision.
What does the end game look like? Because the disease is still with us. More infections maybe will continue. If we reopen, they will continue. What do we do?
I think we just have to get to a point where we have a new normal. We have a new normal. We will go to work as we normally do, but we will wear a mask and you keep distances, all right? And we will go home and we probably have, you know, a sister or a brother who is COVID-19 positive, and they live with us. They are living in a room someplace. We are giving them support. We are helping them out until they turn negative. And God knows another person in the family may also get it. And then we do the same thing. That's going to be the new normal. Because when you look ahead, you can't see a time very near, in the very near future, where nobody has a disease. Right. Because as you know, even areas where they have gone back to normal. For example, Israel went, they opened schools, started behaving normally within days. They had to close the schools again and tell everybody self-isolate because the numbers were beginning to go up.
Right.
So we just have to understand that there is a disease with us. There is a very infectious disease, a very infectious virus that is alive in our nation. This is how to protect it. This is how to protect ourselves. And we begin to live with that.
Let's talk about Mutahi Kagwe, the person, and your experience while doing this.
This is me.
I don't know why you laugh. But for instance, so when you look at this pandemic, every day you come before the nation, at least for the first phase. Now sometimes you send your CASs. What goes through your mind when you have to read these very high numbers, sometimes numbers of people that have died? What are you thinking at that time?
Well, the first thing, obviously, is that I'm very empathetic with the situation in the country. And sometimes it is difficult, you know, when you are told that 10 people have died, 200 people have gotten infected. You know, you are a human being, so you feel bad about it. But I have a job to do. And the job cannot allow you, it doesn't allow me, you know, to then go into mourning and stop doing what I'm supposed to do. So I have a job to do. It's not an easy job. And what goes on in my mind is that let's just do more. Let's just do everything that we can to make sure that we can keep these numbers down, all right? So every time I read those figures, I say to myself, what can we expect tomorrow? What is happening in the next 1 month? How can we mitigate these figures? And that's what I keep on thinking about. Right. And sometimes I wake up in the middle of the night and I remember something and I say to myself, that is what we should do. And then, of course, I come and present it to the experts who are here. Fortunately, we have a lot of them, as I said. And then we discuss it and say, what do you think about this? What do you think about that? What about, what did they do in Italy? What did they do in the US? What is the best case scenario? And what is the worst case scenario? These are the discussions that I have to go through with our people every day.
And when you reflect on those 100 days, for you, what was the hardest thing that you ever had to think about or do and make a decision about?
I think that we have had a couple of difficult things to do. For example, when you go and tell the president that you recommend that you cease movement, you know, for all the Nairobians, and that they must go home by 7 o'clock, those are not easy decisions at all, at all, at all. And you realize how much you are going to impact people. And even for the president, when you make those recommendations to him, you can see Even for him, this is not an easy decision to make. But you have to do it. Because the option of not doing it is a lot more expensive in the end than it is. So there were a couple of difficult decisions we had to recommend to the president. We have got a very good committee. Then the National Emergency Response Committee on Coronavirus is a very, very good committee. So when we make these recommendations, we are making those recommendations on the basis of figures that we have, on the basis of intelligence that we have.
And so still on the same, you have to come, repeat the same messages, observe social distancing or physical distance, wear your mask, wash your hands. And then sometimes we've seen you sometimes almost losing your cool as you say this. Why?
Well, let me put it this way. As I said earlier, you know, sometimes it can get frustrating. It can get frustrating. For example, when you are, you know, my mother has been in Nairobi since this thing started. She has never been able to go home, all right? And of course, she tells me that you are the one who is closing me in Nairobi. So, and then of course I tell her, you know, even the president's mom has also got the same issues, and a lot of other mothers in Nairobi. So when you see that, and then you see people who are trying to beat the same system that is even affecting you at a personal level, it can get pretty frustrating sometimes, especially when you know this gentleman or this lady is going to go out there, and the next thing that is going to happen, you are sure, the next thing that is going to happen is that we are going to have cases in that place. Now the government has to go to start worrying. What are these people going to eat? Where are they going to stay? Where are they going to, what sort of mental state are they going to be in? Why would you want to take us through a situation like that? And there lies the frustration sometimes. And like every human being, you know, you sometimes lose your cool.
Right.
It is absolutely true.
Right. And
not much. Not much, but
not much.
sometimes.
Now that you talk about a family, I remember the first month you addressed the country and you told them that your son and your niece were actually in self-quarantine.
My son was in self-quarantine in my house. We were talking through the door. My niece was actually self-quarantined in a hotel because she came after the mandatory quarantine. My son came before the mandatory quarantine. So, but I put him in quarantine on the voluntary quarantine basis. But, and I didn't really put him. He's an adult. He put himself there. And obviously, by the time my niece came, then there was mandatory quarantine. There was no exception, you know. And, you know, I recall once, you know, in one of the pressers, somebody saying, we hear that, you know, there are some people who are being quarantined and others are going. And, of course, I knew that it is my niece they are talking about. Right. The irony of it was that she was in quarantine herself. You know, and she stayed there for 21 days.
And so how was it for him and family having to put him in such a situation?
He took it in its stride. It's the responsibility. It is expensive. It's not convenient. You know, he's a young man. He'd rather be out there, you know, doing what young men do, rather than being in a house for 14 days. But it just wasn't to be.
Talking about what young men do, let me talk about what men do. And on several occasions, you've seen politicians, whether they're male or female, gathering, whether illegal or legally, and they appear to be doing things that the rest of the country or the rest of the public are not allowed. And there has been that question, are there two sets of laws that are operating in this country? How do you deal with that?
I have made it very clear. Even as late as yesterday, or as early as yesterday, I made it very clear. You see, from our perspective, we know one thing. We know that people get infected irrespective. Not the political party, not the race, not the country, not the geographical boundary, nothing. Nothing. The first cases that we got in Malindi, if you remember, they came out of those kind of situations. The cases that we got in Kisumu came out of exactly those kind of situations. In other words, gatherings. May they be political gatherings, may they be other gatherings. Now, so for me, as a ministry and as CS for Health, my job is to say, you know, that do not go into gatherings. all right? Because if you do, then the possibility of spreading this disease is very, very high. There are areas now where people gather, where people meet, for example, in a restaurant, but they do so within certain protocols. Parliament is still on. But if you look at Parliament as you knew it, and you look at Parliament today, even on a busy day like the budget day, what do you see? You see one person sitting over there, the other person sitting over there. You know, that's the new normal. Right. It's a new normal. So I think that we need to understand, we need to separate, because sometimes somebody was asking me, but Parliament is meeting. This Parliament has always met, but it has met under certain protocols. Restaurants, people are open, but they are opened under certain protocols. Where we believe that it is possible to contain, you know, you want the country to open up. And you want people to do as much as you can get them to do. Right. But you don't want them to gather in such a manner as we have seen, you know, in some cases around the country. Right. You know, those gatherings can be very dangerous. We are not stopping gatherings for the sake of politics or for the sake of stopping gatherings. It's not a political issue.
There's an interview that was on Citizen TV some few days ago. The Member of Parliament for Westlands, Tim Wanyonyi, narrating the story about his brother who apparently died of COVID-19. But he says that they were never informed that he died of COVID-19. They were told he died of heart attack. But on the day of the funeral, apparently the rituals were based on the COVID-19 victims. What is the how are the guidelines?
I would be very shocked to hear that because of two things. Number one is that both the Director General of Health, myself, we were in constant touch with Senator Wetangula on this matter, constantly discussing the issues, looking at being as helpful as we can. The brother was in a private hospital, and we knew from the word go, from day two, we were aware that that's what it was. I personally spoke to Senator Wetangula, both to condole him and also to tell him some of the protocols that they might have to do, the testing and so on and so forth, the contact tracing that may be necessary even within the family. And of course, these are my friends as well. I mean, that family, they are my friends. So I was not just condoling strangers. I was condoling also family members, you know, people that I know very well. So, and that has happened to many families, and will continue to be the case.
Do you think there's a way you can accommodate, because, I mean, you've lost a loved one, and there are those that feel they don't get that opportunity to say their goodbyes in the best way possible. Do you think there's something more that can be done to make them more comfortable?
I think that, you know, what we have worked on is something that also accommodates certain things that people need to do. But I think the reality of it is that it is very difficult for us to observe every measure or every culture that we have been able to do in the past. God forbid, if you look at what happened in all these European countries, starting as you watched on CNN, what was happening in New York, you know, as late as last month, where you see these mass burials taking place. Today in Brazil, that is exactly what is happening. And we have got mass burials taking place. So even as we think about this, even as we are sensitive to the inconveniences and changes in our culture because of this pandemic, let's never forget that the reason these measures have been taken is for protection. First, protection from possible infections if the bodies are not handled properly, infections of people attending the funerals and therefore infecting each other. And then, you know, you don't go to a funeral to go and get your death. You go to a funeral to condole. So we need to also understand, yes, we appreciate the sensitivities of loved ones when they pass away. But I think that the most important sensitivity to have is a sensitivity to keep people alive, especially those who have lost people.
And you've told us before that the rot at the Afi house is unimaginable. How far have you gotten to really getting rid of that rot?
Well, it is one day at a time. This is something that has been building for quite a number of years. And it is not something, therefore, that you are going to stop overnight or just get rid of it overnight. You know, this ministry is one that carries a very heavy burden on Kenyans, because there is nothing worse than a person who is unwell not getting treated because somebody in Afya House is sitting on papers, has made a wrong decision, is holding money for something. You know, these are very important. It's a very important ministry in the lives of Kenyans, and very personal, and at a very personal level. So I am determined to make sure that the resources in this organization go where they are supposed to go. And the decisions that we make are made purely to make sure that Kenyans benefit from the government resources allocated for health. That's my determination. Now, I've explained, because some people say now, those people who are doing business there are still doing business there. Say, look, I'm not here to destroy people's businesses, all right? That's not my point. My point is this: if this glass of water costs 100 shillings at the kiosk, in the Ministry of Health, it should cost 100 shillings. Now, let me tell you what they come back and tell us. They say it is 100 shillings if you buy it at the kiosk, but you get your part, you know, the kiosk owner gets his money right there. Right. All right? You tell me to sell it to you at 100 shillings, and you pay me 6-7 months later. So there's an argument there. You know, but I'd rather we agreed that this is 10 shillings, as is in the kiosk, and then we agree, if I don't pay you on a month-to-month basis, then we can build in the cost of money. Because if I pay you when you bring it, I should pay you exactly what the kiosk owner has. So we are not saying that we came here to destroy people's businesses, but it must be legitimate businesses.
What is that strategy like? Is it kicking out people? Is it?
Well, let me not say kicking out people. Let's just say that sometimes it is necessary to change and bring in new thinking, new blood. And that is why over the last 100 days only, you know, there are people who have been here 8, 9 years here in procurement, in finance, in elsewhere, who we have changed for their own good as well. Right. You know, let them go and see other places. The ideal situation is that, for example, in procurement, you are supposed to work in any station for no more than 3 years. And then you move on to another station, and other people come in. And that mix is good. That mix of people is necessary. Because, again, new thinking, new ideas, but also transparency. So that you create transparency. And when people stay in one place for too long, what happens is that they begin to think the same, and they begin to build the same cartels. So we are not saying that people who are being moved out of the ministry are guilty. Not at all. We are simply saying, let's give opportunity to see whether the new people who are going to come are able to perhaps think differently, create a paradigm shift, so that whatever is going on here can stop. Right. And it's a lot of it. You know, it's a lot of it. There's a lot of... and you see, inefficiency in itself is a problem. Because when you are inefficient, you delay. It means that you are delaying justice. Mm-hmm. And in the case of the Ministry of Health, we can't afford a delay. Sure. You know, when you go to hospital and you're looking for medicine, how much delay can you afford? You can't. You need it then. There you go.
I want us to wind up. Allow me to ask you this. It's a bit personal, but you know a guy called Kahush?
Yes, Kahush. Of course, that is my youngest son. His name is actually Kaumburu. But somewhere along the line, Kaumburu became Kahush. He is a student. Right. He's a first-year student at Nottingham University in the UK. He is also a rapper, and a good one too. You know, and I listen to his music sometimes. Right. You know, Missy Wezi, and so on and so forth. Yes, I do know Kaumburu.
Can you rap a verse?
No. That is for him. I leave that one to him.
Okay, all right. Of course, that's interesting. And I asked this in the light of yesterday was the Father's Day.
Yes.
And of course, in this country, there are those people that feel, people who are prominent, and I regard you as one, you would be strict with your children, but also, how has that been for you to allow your children to be what they want to be, to study, but also to play a little bit?
I think that, you know, every person's life is different. The life that I lead is not the one my father did, all right? And therefore, I think my children are going to have their own lives also. I mean, after the age of 21, you are an adult. You carve your own path. You go the direction that you want to. And you use what talents God has given to you, because people are gifted differently. So in our family, we have got people who are musicians. I mean, the Kahush is one of them. Kagwe, my nephew, is the other one, Kagwe Mungai. So there's another musician. We have golfers. As you know, we have some of the good golfers. Right. You know, Mutahi and Joroge and Kagwe. You know, Mutahi is a junior golf champion in Kenya. That's my nephew. So that is a golfer. That is a rapper. That's another one who will do something else. Who knows what the next one will do? But I think it is so important for us to support, you know, as a parent and as a father. My feeling is that what to do is, yes, you guide your children, but you also support what talents they have, and you give them the opportunities that you can, not necessarily in your direction.
Talking of talent, there are certain things you've said during your addresses to the nation that have come to be memes now. Talking of getting it. Do you ever plan to do these things?
No. You see, it is not me. I'm not that creative. I'm not that creative. You know, it is just that I think Kenyans are fantastic. And it is great that they have got that creativity, because I get to laugh too. Right. You know, I get to laugh the same way you do. And I enjoy the humor the same way you do. And as I have said elsewhere, I think that life is tough enough. If you can get a good laugh out of something, you know, let's have it. Because, I mean, all these Mutahi specials, you know. I don't know whether it's Mutahi special or Kagwe special. One of them anyway. One of them, I know there is a special. Right. I know that, you know, even if you go to the village, right, even if you go to even 10-year-olds and 5-year-olds, if you behave normally, now they say all of them.
The disease will treat you abnormally.
But you know, but it is communication as well. Because when they sing all these get it, you can get it, I can get it, it sinks, the message is clear. This is a disease which everybody can get.
So you said everybody can get it, your son said, Missy Wezi.
Yeah, akasema Missy. He said Siwezi before COVID-19. Yes, I think now, I was actually persuading him, I was telling him, why don't you sing another song called Mi Naweza? Why don't you rap another one? That was Missy Wezi. Right. Why don't you rap another one, Mi Naweza? So that we balance. But anyway, I think it's great. I think Kenyans are creative, and that's fantastic.
Mm-hmm. All right. Thank you so much, Waziri.
You're welcome.
If you didn't have Corona, you'd have...
No, we can always, you know.
Is it?
Thank you very much.
Right.
Asante sana. Asante.